Perfect. So thank you for everyone who's come and joined us today. The point of this webinar is to really help our family medicine applicants, and also everything we're talking about is actually also applicable to internal medicine applicants. But we realize the application process for applying to POCUS fellowships is quite novel since this is a new opportunity. And so that's the focus of this webinar. And we'll go ahead and go through and kind of cover as much as possible, and we'll save the questions to the end. The topic, as you all are aware, is POCUS fellowship opportunities for the family medicine applicant. And if we have any internal medicine applicants, we are here and ready to help answer your questions, as well as they are some similarities. So I would like to give a shout out to SCUF. So this is the Society for Clinical Ultrasound Fellowships. Many of you have probably never heard of this organization before, but it was founded in 2008 to help the emergency medicine residents and fellows kind of navigate the fellowship application process. And the purpose of this was to support the transparency and the quality of fellowships, and also creating a central agency where you could see exactly what programs were offering, down to what instruments of ultrasound machines were being used, and allow you to compare programs more readily. And so they have offered to have programs for even IM and FM listed. And so it's becoming a great hub for us to kind of help unify and list information in a more easily accessible format. So thank you to SCUF. And then just going into the host. So I'm Nicole Keane. I am a physician in internal medicine, and my specialty is hospital medicine. I work at Temple University in Philadelphia, and I am a co-director of our Advanced Clinical Ultrasound Fellowship that's in combination with emergency medicine and internal medicine. I also run the ultrasound education for the internal medicine residency and consult for other departments that are trying to build POCUS curriculums. And then I am also a co-chair on the multidisciplinary subcommittee for SCUF, and I will hand it over to Kyle, who is my additional co-chair, who will be helping to host and run this meeting.
Hi, everybody. My name is Kyle. Thanks, Nicole. I have a background in family medicine, and after residency, I did a one-year fellowship at the University of Pennsylvania in point-of-care ultrasound. And I'm currently working at Brown University with the family medicine residency program there, and I'm in charge of POCUS education for them. And I'm also involved with the medical school as well in teaching POCUS.
Thanks, Kyle. I should also say I did complete a POCUS fellowship. I am not self-taught, so I am also a graduate of UPenn's program. And so thank you guys all for attending, and we'll continue on. So the agenda for this webinar is first to talk about the application process and go over what components are actually needed, give you an idea of what the timeline looks like. And then we're going to cover fellowship interviews, different things you should be thinking about, questions you might need to be asking, and then the job search. So what does life look like after a POCUS fellowship, and what are the opportunities for you after completing a POCUS fellowship? And then we will move on to our panel and do a question and answer session with our panel. At that time, most of you guys are muted currently. So if you'd like to raise your hand and ask a question, you may. Otherwise, you can use the question format in the chat function, and we'll make sure to get your questions answered. And right now, I'm going to ask Kyle to launch the poll. This is just a background to get an idea of who's currently attending this session and make sure that we're addressing your needs and trying to help plan for questions and such moving forward. Kyle, do you want to give me the nod when you've released that?
I'm currently looking for that. You can expect it shortly, but I'll let you continue with your slides.
Perfect. Okay.
Yeah.
So first, let's talk about the application process. So, things that are important for your application. First is the CV. This is something that we all kind of put off and don't like dealing with, but the sooner you get used to updating it periodically so it's not such a chore, I highly recommend, whether you're pursuing POCUS fellowship or not. It is really easy to forget about all your professional activities, and later when you're applying for promotions and such, it comes in handy. So that is the first part of your application. The second would be a headshot. This is a professional photo, typically similar to like a passport photo or the photo you would have used during your residency application process. So shoulders up, professional attire. Uh, Next would be letters of recommendation. Depending on how you're applying in each program, it varies from 2 to 3 letters of recommendation, and some programs are actually just asking for references. So if you are, and we'll cover this in a moment, but if you're applying through the SCUF website, they tend to ask for specific letters of recommendations, whereas if you're applying directly to programs, sometimes only references are needed. Obviously, when you're choosing who to ask, you want people who can speak to you highly and speak about your efforts clinically, and if you have any POCUS interests, positively. And sometimes we all need a nudge when we've been asked for these things. So don't be afraid to send an email reminder to them to let them know that a deadline's approaching and such. And don't feel like you can't apply without your letters of recommendation being ready or submitted, because fellowship directors will look at your application even prior to those being submitted. Next, you'll need a personal statement, which should be about a page. And I would recommend choosing a topic or a case that inspired you to pursue additional training in ultrasound. And then application fees. So if you're applying through the SCUF website, which a lot of the programs do accept applications through, then it's $100 for your first 10 programs. And for any additional programs that you're applying to, it is $10 each. So definitely cheaper than the residency application process, but still a cost to it. And then for any programs that are accepting applications outside of the SCUF website, there actually isn't a cost associated with those. And then I want to just share these QR codes with you. Please feel free to scan them. And this will be uploaded for use at a later date as well. But the first QR code is actually for the American College of Emergency Physicians, ACEP. They developed a fellowship application kit for the emergency residents who were applying to fellowship. And this is a really great place to kind of get examples of what your CV should look like. They have examples of personal statements. So for those of you who maybe have not written about your POCUS or ultrasound interests previously, this could give you an idea of what they're looking for. And then they also give you a list of commonly asked questions. And then the second QR code is specific to the SCUF website, just giving you information for fellowship applicants on a step-by-step guide. So first logging in, uploading your application, an idea of the costs, looking at each of the programs, and they have a good comparison of many of them. And then you will be contacted by either a fellowship director, or sometimes there's an administrator or recruiter who might be also managing the application process. So you will be contacted to schedule the interview itself. Now, the next part is where to apply. Obviously, the United States is very large, and when it came to other specialties and when you're applying for residency, there's a lot of options. But POCUS fellowship in the United States for internal medicine or family medicine residents is more novel. So the first program actually didn't start until 2011, and that was the University of South Carolina. And so that was the only program until 2016, when both OHSU, which is an IM predominant program, and UPenn, which created a combined program, started. And ever since then, each year there's been more and more programs, but it's important for you to think if location is your priority versus certain aspects of what the program would be providing. So just something to keep in mind, and we'll go over each of the areas in the country based off of geography. So first we have the Northeast region. So here you will see the majority of programs in the Northeast are actually combined emergency medicine programs. So their primary specialty is emergency medicine, and they have expanded to accept family medicine and IM applicants. So in Massachusetts, we have Boston Medical Center in Boston. We also have Brown University in Rhode Island. That is a new program that will be accepting applicants for the class starting in 2026. We also have in New York, Nuvance Health at Vassar in Poughkeepsie, New York. That is a predominant EM accepting alternative specialties. And then University of Pennsylvania, which was the first multidisciplinary program in the country. That is predominantly EM and then accepts FM and IM applicants and sometimes even has subspecialists within IM. In the grayed out area on this slide, I wanted to point out programs that aren't currently listed as accepting family medicine programs. But again, if location is something that's really important to you or ties to an area, then it's worth reaching out to some of these programs as they might consider taking family medicine applicants. So, for example, my home institution, Temple, we have a joint EM-IM program. We've talked about accepting FM applicants, and it's just a matter of whether or not people are able to handle the clinical aspects of fellowship outside of their predominant specialty. Within Pennsylvania, we also have Thomas Jefferson University, and then in Connecticut, there's Yale University. And then we also have an IM only program, which is Cornell University in New York City, that is predominantly IM and has also talked about accepting FM applicants. Moving on to the Southeast region, we have the first program, as I mentioned earlier. It's a combined IM-FM program, Prisma Health Midlands through the University of South Carolina. So that's the institution in South Carolina. And then there's a combined program in Virginia and Georgia. So in Virginia, we have Riverside Regional, that is predominantly EM and accepts applicants from FM and IM. And then in Georgia, we have the Medical College of Georgia, which on their website doesn't have a ton of information about accepting FM, IM applicants, but through SCUF, they do say that they have opportunities for both FM and IM to manage their clinical component of the job. Midwest, we have Ohio State in Ohio, and then we have the University of Michigan, and we have Dr. Nicole Capizano, who's on our panel, and she's the fellowship director at that institution. She runs that program, and that is also combined, but at like 80% a family medicine program. And then University of Illinois is a combined program that is predominant. Its primary specialty is emergency medicine, but they say they take internal medicine applicants as well. Next, we have the Northwest region. So even though this is a lot of territory, there's actually only one program, which is Oregon Health and Science University in Portland, Oregon. And that is a primary specialty of internal medicine, but they also accept FM applicants. And then moving to the Southwest region, there's again only one program here. This is the University of Arizona in Phoenix. Its primary specialty is emergency medicine, but it is accepting applicants from FM and IM. And this is a newer program as well. So I think their first class of just including FM or IM applicants would be in 2026. So another aspect that's important that we talk about is the match. So when you're applying for POCUS fellowship, there is a match through the NRMP. So this would be similar to what you went through when you were applying to residency. When you were in residency and applying to this, every program that you were considering would have been through the NRMP. However, given that this is more of a novel fellowship and programs are just trying to get started and build their programs to make sure they can help train applicants in their own specialty, not every program goes through the NRMP. and that does not comment on the quality of the program. So when you're applying to programs, I would recommend applying to the programs that interest you most, whether it's based off of what they're offering, whether it's location, as sometimes that's a primary focus. I would apply to all those programs, and then once you decide which are your top programs, whether or not to go through the match is your option. I would say at this point in time, the majority of programs that go through the match for family medicine and internal medicine applicants is because they are primary emergency medicine programs, and they are typically having their applicants apply through the match. And when you have an FM or IM predominant program, since they're not using the match, they don't have enough applicants or a big enough program or have been around long enough, they would not be going through the match, and that does not reflect on the quality. So go based off of the program you want. And that being said, when you're considering what the timeline looks like, so if you're applying to programs that are going through the match and going through NRMP, which is the National Resident Match Program, applications typically start as early as July or August, where you would be submitting your application, and it's rolling admission. So the earlier you submit your application, the earlier the next steps of the process in terms of interviews will occur. The match opens August 20th, and that just means that the website's open for listing your preference and programs. And September 24th, rank opens, so you can start putting in which order you would want the applications. And the deadline to submit your preference would be November 5th. And then on November 19th of 2025 is on match day, is at noon. The interview process, so the reason I mentioned rolling admissions, once you submit your application, the interviews happen whenever the application is submitted. It's not like a specific period. But once obviously the certification of your rank list is due, there won't be any applications for programs in the match. And then the general application timeline is a rolling process. So if you're applying to programs in the match, you can definitely apply to these programs in July and August, and then you will be contacted to schedule the interview. And programs that are outside of the match tend to be rolling, meaning as soon as they receive your application, they interview. If they think you are a good applicant, they would be offering you a position right away. And it's not that they have to wait to a certain time of year. So typically, if you're applying July, August, interviews would be starting early as September. And then while they have open spots, that would continue on for the rest of the year. And so if you have a certain program or area you want to go to, I would highly recommend applying on this timeline of summer into September. And then I'm going to hand it over to Kyle, who will talk about the interview process.
All right, thanks, Nicole. Um, so I'll be brief with this section because at this point in your careers applying for fellowships, you've been through this many times, and this time is no exception when it comes to the do's and don'ts of interview day. Um, as Nicole mentioned, depending on whether the program's in the match or not, the earlier you can get your application in and in the office of your potential program director, the sooner they can decide if they're going to have you come in and to meet you in person. So, very important to make a good first impression if you can, arriving early. If you're there in person, making sure parking's sorted out, that you know where the room is, and that you're ready to go. And then when it comes to virtual only interviews at programs, making sure that you're able to navigate the software and get in on time. You have such a short amount of time to get to know some of these groups of people, and oftentimes the POCUS family at whatever fellowship you're applying to is pretty close knit, and they're thinking about having you join their family and doing video review with them week in and week out. So they want to see if there's chemistry there, and the more accessible you are and more honest you are about yourself, that can only continue to provide opportunities for you. So from being on the other side of the interview process, I've seen that being something that people can really stand out at when they're honest and they're able to talk about their experience in POCUS and what their interests are. Um, As I mentioned, the POCUS community is a close one. So if you decide towards the end of the process that you've decided against a certain program, try to cancel early. And that way, you're showing as much respect for the program as you can. And that you're doing your best to give them the chance to hire the people that they want as well. For NRMP rules for communication, so on their website, um, they make it clear for applicants to limit post-interview conversations. Now, what makes this a little trickier than residency programs is that with some programs in the match and some not in the match, there can be some difficulty from the applicant's end in navigating that process, especially if you hear about acceptances at one program before you hear about acceptances at another. Um, and that's kind of the nature of where we're at in the early days of POCUS fellowships for family medicine and internal medicine. But I would encourage everyone to make the best of the situation, to be honest, to be a good communicator with the programs that you've applied to. And at the end of the day, as long as you're open and honest and not putting pressure on the program about making an early decision about an acceptance, then the program and yourself can make the best of the situation and figure out what your next steps are going to be. Um, so that's what I've got for that slide there. Um, I'll have you. Great, thanks. Some questions to research before the interview. So it's good to know who you're walking in to meet. Is it someone within the same specialty as you, family medicine? Is it someone who's trained in emergency medicine and has um, taken an interest in learning what a family medicine applicant can provide? I know firsthand that coming from family medicine, that there are areas like sports medicine, gynecology, when it comes to joint injections, there are things that we do within family medicine that are adding to the curriculum at EM-based programs. So, while it's helpful to know how much you have in common specialty-wise with your program director, at the end of the day, if they're showing interest in you and they have a strong program, it's helpful to know where your connections are and where you can learn from each other. Um, so primary specialty of the ultrasound program, the fellowship director, and are there connections within the family medicine department at whatever institution you're going to? So if you're deciding to go there and you're interested in teaching, knowing what influence you have with a residency program or at the med school can be helpful to know as well. And a lot of these programs will list on their website or on the SCUF website what involvement they have in teaching at that level. So you can do some research on that beforehand. And then if it's something that you have a background in, knowing what kind of ultrasound machines they have, handheld versus cart-based machine, what kind of software they're using, are you going to learn how to bill for this after fellowship? Those are useful things to pick up in fellowship. You'll want to know how you're uh, basically covering your educational time in fellowship. So after residency, the expectation is that you'll do a certain amount of work to maintain your contract at that institution. And that could be on inpatient exclusively. You could do same day visits at a family medicine clinic, which was my experience. That was how I funded my clinical time. And then the rest of the week is typically spent with video review, um, educational sessions with the residency program or the medical school. There's different versions of the educational part of your week, but when it comes to the clinical aspect, you'll be spending most of your time doing that, and it's important that that's something that you're interested in as well. So whether it's inpatient, outpatient, ED observation unit, there's a lot of creativity at these institutions to figure out a way to stay productive while you're learning POCUS, and hopefully taking what you learn in the educational days and working it into your educational time as well. Also helpful to know where the contract stands with the family medicine department or with the EM department for that clinical work, and if there's any room for negotiation of that contract with that department. So that's sort of a more detail-oriented question to ask at the interview, but it's important to know and advocate for yourself if you are interested in the program, but there are certain parts of the contract you wanted to negotiate. So worth bringing up. And I'll move to the next slide. So it'll be useful to know to what extent you'll have supervision during your scan shifts. So will you be in the emergency department with an attending, with a resident? Or are you going to be going along with medical students? Is there a sonographer educator? There's different versions of the educational aspect of this. So that'll be key at the beginning of the year and developing your learning as time goes on. To what extent will you have procedural training when it comes to transvaginal ultrasound? Is that something that's incorporated into the education? Um, Doing joint injections, things like that. Some programs have a sim center where you can incorporate that into your learning. And there's different ways of utilizing mannequins to help with certain kinds of procedures that involve ultrasound. Um, do you have a protected image review time during the week, or is it something that's rolling throughout the week and you meet virtually? Um, you'll find that at a lot of these programs, there are research requirements. So asking about what's been done at those programs in the past can clue you into what your prospects are, if that's something you're interested in, and to what extent you go to national committee meetings. So we mentioned at the beginning a few of them, and there are a lot of opportunities for Family Med POCUS fellowship alums to meet each other and coordinate. And it happens every year, and it's an exciting thing to be a part of. So if you can use fellowship as a stepping stone to meet a lot of these people who are passionate about POCUS, then beyond fellowship, you can really stimulate the network that you have and what you accomplish after fellowship as well. Um, I think I'll skip this slide. I covered most of it indirectly. Right. So after the interview, doesn't hurt to send a thank you email afterwards and let them know that you're interested in the program. Some of them might have a second look, some of them might not. It's not a necessary component of things, but like I mentioned before, communication is key. It's important um, to limit the extent to which you're communicating with the program afterwards, but um, with a lot of moving parts as the applicant, it's good to reach out if you have any questions or especially if you have any confusion about the application process, because as we know, and a lot of us have been through, it can be hard to navigate at first. And I know that the folks here on the panel are here tonight and they're committed to helping anyone applying to get through it in a way that is advantageous to them. So you have people who really want to help. There are some mentors listed on the SCUF website. You have us. We'll go over an email at the end that you can reach out with if you're confused. And we're here because we want to grow the community. So, we'll keep that in mind as application season comes along. All right. And I'll do the next slide. And then before we get to the panel, just a couple of questions to leave hanging out there for us all to think about. What do you want out of a fellowship? What do you want to make sure that you learn during your fellowship? What do you want to do after fellowship? And what's your 5-year plan? So it's good to keep all of that in mind as we're getting closer to this application cycle, which is really kicking off in a few months. So with that in mind, we'll transition towards the next segment here, and we can change slides. And we'd like to introduce our um, experienced and amazing panel, and we'll introduce them one by one just in the interests of time. But I'm excited to give them a chance to talk as well.
So we have, I apologize in advance if I screw up anyone's name. We have D. Connie Beer. She is an emergency medicine physician. She is the POCUS Fellowship Director at Columbia University, and she is our future president-elect of SCUF, but is still very involved in everything at this time. So we're lucky to have her here to kind of comment on any of those questions. We also have Dr. Nicole Capizano, who is family medicine trained physician. She is the POCUS Fellowship Director at University of Michigan, which is a predominantly family medicine program. We also have Dr. David Keane, who's family medicine. He was a past POCUS fellow at the University of Pennsylvania. He is an associate of POCUS at his clinic, associate POCUS director of the FQHC, which is a federally funded health clinic in Virginia. We also have Dr. Natalie Wynn of Family Medicine. She is also a past POCUS fellow and is the clinical ultrasound director at Kaiser Permanente in California. Uh, Next, I'd like to introduce Laurel Gutierrez, who is a family medicine physician and a current POCUS fellow at University of Michigan. And we also have Justin Anderson, who is a family medicine physician and also a current POCUS fellow at the University of Ohio State. I should say Ohio State University. And then we have Raymond Chung, who is also a family medicine physician. He is an upcoming POCUS fellow who will be starting in July at Ohio State University. And lastly, you guys already know Kyle Flattery, who is a family medicine physician, and he is the co-chair of our SCUF multidisciplinary committee, and he currently is working at Brown University. So as we go into the next part of our session, we will have the floor open for questions. If you have a general question, please feel free to ask it. If you have a specific question for one of our panelists, please feel free to direct it their way. There will be two ways in which you can ask questions. You can either post something in the chat and I will ask our panelists, or if you'd like, you can raise your hand and I will allow you guys to speak and ask your questions yourself. So with that, I'm going to stop the screen share so that you can see all of our panelists. Okay, and I'd like to open up the floor for any questions that you guys might have about any part of the application process. While we're waiting for those questions to come in, I guess I'd like to pose a question to each of our panelists. Why did you decide to pursue a fellowship in POCUS? Dee, I think I'll pass the mic to you first, and then I'll name each of you as we go through.
Awesome. Thank you so much, Nicole, and Kyle. Thank you so much for that wonderful introduction. I think the thing that primarily led me to ultrasound was the ultrasound community. Obviously we all find efficacy in the use of ultrasound for diagnostic, for procedural guidance, and it's something that has made me a better physician. But what really kind of cemented my desire to kind of go down that fellowship route was just all the ultrasound mentors that I had in residency, and these were the people that I wanted to be with. And so I think truly the ultrasound community, regardless of specialty, is some of the most collaborative people I've ever met. And these are the people that I wanted to continue to work with throughout my career. So.
That's great, Dee. Thank you. Justin, I'll pass the mic to you.
Yeah, for me, I would kind of say what wasn't to like. It's a great opportunity to develop your skills a little bit more in a like booming area. This is going to be, they have been saying for years, like the future stethoscope. I don't know about that, but it's a growing massive area in medicine. It's in family medicine, it was just added to, requirements. So every program is now going to have to teach ultrasound in their curriculum. And so it's a massive booming area there. And every program is looking to have someone do POCUS. They're telling people like, hey, you do POCUS. So if you're in education, it's a great opportunity there. It's the people on the panel all know the kind of saying that like POCUS education isn't just POCUS education, it's teaching education as well. So if you're going to go into academia, you're going to have a lot of opportunity to teach medical students, to teach residents, ultrasound and the patience that kind of comes with keeping your hand off the probe while directing someone to kind of manually do the things that you think would be helpful for them. And then kind of the programmatic background as well. So that's really helpful. And it's also kind of like a condensed fellowship. It's a year, but it's like not full time doing POCUS fellowship. You're still practicing, you're still seeing your panel and those types of things as well. So a lot of things to love.
Thanks, Justin. Laurel, I'll pass the mic to you.
Yeah, I think going through family medicine residency, I love patients. I think seeing people in clinic is one of like the special things in being a family medicine and a primary care doctor. But I also saw that a lot of times I was saying to patients, hey, go get these things done. Go get this ultrasound and we'll talk about the results later. And not only is ultrasound awesome and really fun to do, but it's a really cool experience to sit with someone in the patient room and talk through the ultrasound with them. Nicole Capizano just got to help me like think through stuff for a patient where they came in with a possible pregnancy and thought they were maybe having an ectopic pregnancy. And this is like an hour and a half ago, was doing the ultrasound and walking through with them what I was seeing. And it really builds trust with your patients and really helps them to feel like you care when you're actually like taking the time to do something like this with them. But it also really helps you to be making really good clinical decisions for your patients as well. And actually being able to do those things faster for patients and getting them access. That's an issue around the country, getting people care. So I think that's one of the things that I saw when I watched the ultrasound fellows before me do the fellowship is that I thought it really helped their ability to do the medicine that they wanted to do. And then on top of it, all of the other things like getting to teach people about ultrasound. I think also really like getting to hone your skills in medicine and have like that year to be able to like say, hey, I'm a fellow and ask a whole bunch of questions that you might not have even thought to ask in residency. So I think all of those things were a big piece of why I decided to do a fellowship.
Great. Thanks, Laurel. We have a few questions coming in from the audience, so I am going to just allow you guys to answer, but if we could keep our responses quick. David, if I'll pass the mic over to you.
Yeah, I'll say the reason that I picked doing a POCUS fellowship is just to have that intense year of training where you can get a broad set of skills. I think as a doctor, you're always going to, learn things later in your career. But I think if you really want to do a lot of POCUS, more than just like one application or two applications, really doing a fellowship will give you the groundwork to really expand your skill sets, especially as the field expands.
Great. Thanks, David. Nicole?
Oh, okay. Well, for me, it was really more like a necessity in my department. They really wanted to start POCUS and they really wanted somebody who wanted to be kind of the leader on everything. So to me, for the very beginning, when I decided to be a POCUS champion, my answer was yes, and I want to be an expert. I didn't want it to be something that was going to be in the middle. And the main reason it was also because I was going to be responsible for teaching not only residents, but also teaching faculties. That was fantastic. I will say that's the best thing I've been done, during all family medicine. It's a fantastic group that we have, that we are together, that we can work with different people. We can meet people on all the world, all the country, and also all the world. We were meeting people from other countries that they are starting doing POCUS. So that was basically my goal. Yeah.
Okay, perfect. Natalie?
Hi, I have to echo what Dee said. It's more about the people that you meet that can do POCUS. Prior to doing fellowship, I only had maybe one other person I could lean on, and they were still learning ultrasound from the very beginning. So it's nice to have someone you can kind of bounce ideas off of, bounce patient cases off of. The other thing that has really helped me out from doing fellowship is learning how to do the admin aspects of it. It's really complex, so that's been incredibly helpful. And coming back to my institution, there are some special circumstances that I have been able to talk out with my mentors and colleagues. And then third, I think it allows you to use POCUS and to get better at your clinical skills at the same time, because every day you're using POCUS and you're using it during your fellowship and in clinic, and to marry those together and to have time to do research to do the clinical management, I found to be incredibly useful. So it's been much, much quicker now that I'm working full time. I can use POCUS much more efficiently than I feel like I would have if I didn't do fellowship.
And Raymond, as our future POCUS fellow.
I'm a street doc here at Boston Health of Homeless, and where POCUS really shines is in low resource settings. So when you're seeing patients in an encampment, you're seeing patients on the street, there are no specialists, you don't have a radiologist, you have no x-ray techs. So really what you got is what you have inside your pocket. That's where POCUS really shines. We need to be, POCUS needs to be a mandatory skill in street medicine, and we really have to be the experts, because if you don't know POCUS, what else you got?
Very true. And Kyle?
I would say that for me, I was interested in going into academic family medicine and teaching at the medical school level and at the residency program level. So I was able to learn a skill that was useful to me clinically, and it opened the door for me to get involved with academics. So I initially thought about doing faculty development, which typically is a 2-year fellowship. And in 1 year, I got POCUS training and countless hours of practice teaching med students, residents, and even faculty. So it's a really creative way to enhance your teaching and to give you chances to stay involved in academics.
Nice. I'm going to go to our Q&A from our audience. We have one question that I'd like to direct to Nicole. If applying to programs outside of the match, is there a downside to reaching out to them sooner than July?
I would say that there is no downside. I think it's a great idea to reach out, especially if you have some specific questions or you are concerned about something that you've been missing. So I will do that.
As a fellowship director, I've had people reach out, or like even a year in advance, because they were asking about the process. And I respond and let them know, and they have subsequently applied. So I don't think there's any downside. And if you want to apply before July, it just shows how interested you are. They might not set you up as fast for an interview, and I wouldn't take that personal or as a negative. It's just more whether or not they have the support staff in place, but you can definitely reach out or ask any questions. Awesome. I'm going to ask Nicole another question. What type or amount of experience is expected of incoming POCUS fellows, and how can trainees in a residency without robust POCUS curriculum obtain said experiences?
I don't expect that my fellow needs to have a lot of experience. I think it's okay if they have just minimal experience during residency, or even if they have zero experience. I am okay with working with them from the beginning, from zero, basically. How they can get the experience during residency, I didn't hear very well the second question that you say, Nicole.
They wanted to know how they could obtain experiences if it was expected before applying.
Oh, maybe they can try to get some videos. I would personally recommend the free videos that we have at STFM, Society Teacher of Family Medicine. So those videos are really, really well done and are the same that we use for the POCUS certificate. So I would recommend to try to do those videos and then try to start doing some practices, even if they don't have anybody who is gonna be reviewing their images, but at least try to start doing some practices using those videos. There are also several websites like a 5-minute sauna, things like that. It's, if they want to get more information, that also is going to be okay. Yeah.
Natalie put a link in the chat, 2 links actually, one to STFM resources and also to 5-minute Sano if you'd like to look at those. I'd also like to echo, pun intended, for 5-minute Sano. It gives you like a 5-minute introduction and gives you a lot of the basics that you would need to know. And sometimes they have even advanced clips on some of the additional ACP is also another one, which Natalie, thank you, added to the chat. If you are an internal medicine resident, sometimes your programs pay for your subscription as a preparation for board review. They have free courses as well. As a fellowship director, I don't have any expectations of you coming in with significant exposure just because there aren't a ton of programs in the country that even in residency level that give you that. So I think, preparing yourself and reviewing that stuff is good. And as Nicole said, you can kind of practice on your own if you have access to an ultrasound machine. I will ask some of our current fellows how much exposure you had to POCUS before even starting to kind of help with that question. So Justin, how much did you get in residency before starting POCUS fellowship?
Yeah, I did quite a bit. I did some in med school. We didn't really have a curriculum, and I that's where I like first discovered POCUS and really got excited about it. And so it kind of helped start a curriculum in medical school. And then through residency, I chose Ohio State for residency because I wanted a part obviously a lot of different reasons why you choose a residency, but one thing that was really unique about Ohio State is that it had a really strong POCUS curriculum as well. And it had a POCUS fellowship program. So definitely got quite a bit of training through that residency as well to help prepare me. But that being said, my fellowship director said at the beginning of the year, every single year I put on a different fellowship for depending on who I have. There's no fellowship year that's the same in terms of the education. So there's a wide variety of, not a set expectation of knowledge that you have coming in, just a drive to learn more.
And Laurel?
Yeah, I think I obviously have Nicole, which is amazing. And she was kind of starting up the program when I started residency. So I really didn't have a lot in medical school. And then I would say that for those out there who maybe are later in residency and thinking about this, I did not do much ultrasound my first or even for a good part of my second year until I started doing some of the trainings that Nicole had for us as residents. And that's when I realized that I actually really loved ultrasound. And so it was really towards the end of my second year that I decided that I was interested in doing a fellowship and doing more ultrasound. And so I actually didn't have like a ton of experience when I was applying. And then I spent a lot of my third year elective time doing ultrasound because I wanted to. But I would also echo that you don't have to have like a ton of experience to apply.
And Raymond, as a future POCUS fellow, did you have a ton of training before applying or thinking about this as a career?
I essentially had no POCUS experience until PGY2, and that's when I ended up buying my personal butterfly. I think the big thing is that even if you're at a program that doesn't have a lot of POCUS experience, such as mine for residency, finding someone in the medical community, whether that be a sports medicine doc or OB-GYN, who's willing to at least teach you some of the basics of POCUS, and then trying to at least incorporate into didactics. Like if you have a residency-led component didactics, just essentially trying to at least look at the various videos that are online, such as like 5 Minute Sono, or even potentially, setting up a day where everyone goes into the sim lab can be useful.
Nice. David, how about you? Did you have much exposure before starting fellowship?
I would say when I was on a lot of rotations as a medical student, I was always very interested in ultrasound. So I did do an elective as a medical student. And then when I was a resident, there wasn't any place to do POCUS in my residency program. So I actually did an elective. I did two-week electives with radiology, and I found that helpful just to help give me the basis of like, okay, what is ultrasound? It's not POCUS that they're doing, but it's sort of the same with image acquisition and how does ultrasound work.
That's a great idea. Asking for an elective in radiology and ultrasound and interpretation might be a way to kind of get supervised, at least supervision with interpretation, even though you're not getting the hands-on, but you'll have fellowship for that. Awesome. There's another question posed in the chat. How do rank lists work when applicants are applying partially through NRMP and directly to individual programs? And should that be communicated to all programs? I'm happy to field this question or Dee or Nicole, if you would like to answer, please feel free.
I can take that one. So I wanted to clarify the role that SCUF plays and the role that NRMP plays. So SCUF houses the repository of fellowship programs that registers with SCUF and hosts the platform in which applicants can apply to fellowships, any fellowship. And so if you're applying to fellowship through SCUF, you can apply outside of the match, either via SCUF or contact the programs directly. Either way, SCUF does not care. However, if that particular program has a contractual agreement with the NRMP and that program I guess goes through the match via NRMP, then that program cannot accept a candidate who is applying to them outside of the match until match is over. And so I guess you wouldn't have a rank list if that helps clarify.
Yeah, and I would add, what the follow-up question was, should this be communicated to all programs? I would say when you're applying to programs, this is complicated because some programs are through the NRMP and outside of it. And all of the programs are one or the other. So you don't have to worry about navigating whether they're partially or you might get an offer outside of the match. So I would say once you've interviewed at all of your programs, if you decide you want to go to a program that's outside of the match and they offer you a position, then you can accept that position and you should notify the match programs that you're withdrawing from the match. That way you're not ranked. If you decide that the best program that you want for you is through the match, then you'd want to enter the match and list whatever programs you're willing to consider. If in that time frame while you're waiting, you get an offer from a program that's outside of the match, you can let them know, hey, I'm actually prefer to go through the match. I have a program I really want to go to. And you can potentially, if you don't match, you could always reach out to them after and see if they have a position open. But when you go through the match with NRMP, you are contractually obligated to accept that position if you match with a program. Now, I don't have the name of that question, but hopefully the person who asked that question, but hopefully that answers what you were looking for.
And I'll say that the match is a relatively new phenomenon through SCUF. Only just a couple of years ago, every program was kind of a free-for-all, just like people calling each other with offers. There was like one offer day, and it was a little bit of a chaotic scene. And so to kind of streamline that process and to make it equitable for all the applicants and programs, the match was a solution that was kind of developed. And so not to put a value judgment on it, but that was the reason for that.
Great, thanks, Dee. We've answered all of the questions from the chat. Kyle, is there anything you want to pose to the panel or topic you'd want to see covered?
Oh, I am so sorry, Nicole, sorry to interrupt. And just to answer the follow-up question on whether or not this is going to be communicated to all the programs. So we, because this is kind of that transition to NRMP, it was a relatively new thing. We haven't caught up with kind of formal SCUF policies until now. And so the board just approved SCUF policies that kind of delineate the rules for fellowship agreements for applicants. And so when programs register with SCUF or renew their contract with SCUF, these policies will kind of pop up for them that this is the expectations of our community. This is the expectations of the programs and the applicants.
Thanks, Dee.
Yeah, so it's 9 o'clock now. We got started at 8:05. So for anyone on the panel who has to leave right now, I understand. For anyone who could stick around an extra few minutes, it's much appreciated. But just while we're wrapping up, I just wanted to give some of the other panelists a chance to let us know what they're planning to do with POCUS as they look ahead into the future, which I know is a big question, but I think one of the most exciting things uh, with family med and internal medicine doctors is all the different directions that we've been taking, what we've learned and applying it. So I know, David, you're doing something at an FQHC that is pretty unique from people I've run into who've done POCUS fellowship. Do you mind sharing a bit about what you're doing there and how it works?
Yeah, so just briefly, I'm at a federally qualified health center, which is a type of community health center that we have to see all patients, no matter what their insurance status is. About half of the patients that come to our clinic don't have insurance. So when we talk about low resource settings, this is one of those where we really don't have the option to get any sort of imaging studies in a timely fashion. And usually that takes 2 or 3 months of applying for charity care, financial applications, drives to other places. So we're building an internal ultrasound clinic at our site. And it's really exciting because I think the patients love it. The providers, I think it's really helped providers with their sort of burnout because it gives them a little release valve on some of these more complex cases. And just this week, we are actually talking about maybe doing some ultrasound in the community because we have a mobile van. So, hopefully next year I'll have some updates on how that goes, trying to identify pregnant patients in the community a little earlier in their trimesters.
Thanks, David. I also wanted to pose a question to Natalie about your experience in teaching. I understand that you're teaching at multiple levels within Kaiser. What's it been like to take what you've learned and take on sharing that with people from different specialties and different levels of learning?
Thanks, Kyle. In short, it's been really rewarding to bring everyone together because I teach both internal medicine and family medicine residents, and I teach for both departments. It's been really nice to see how family medicine and internal medicine work together. We actually work very closely together at Kaiser Permanente Los Angeles Medical Center. And then we're also working, because there's a big network within Southern California, there's a Southern California Permanente medical group of physicians where we actually have 5 or 6 family medicine residency programs and 2 or 3 internal medicine residency programs. So among all of the faculty, we're creating a big network and we're able to make regional seminars just for our faculty and make it completely free to teach and to learn. So that's been extra rewarding. There's always an ongoing project, and that's how we also trade resources within the region. And so we're able to make a much larger impact because there's just a very easy network, and even we're all on the same Teams groups and we're all on the same email. So things are never lost between us. So it's been really, really cool. And I'm excited to see what happens in POCUS, both, like within our regions, within our specialties, our collaborative meetings, this is one of them. So I'm always excited to meet more people who do POCUS.
Thanks. Yeah, and on that note, for all of our attendees, thanks for making time outside of your usual work to log in and listen to us. And Nicole, did you have anything else that you wanted to add before we wrap up?
We got one more question from
Oh, we
our.
did. Oh, great. All
I
right.
just
Well,
wanted to pose it to our panel and maybe keep it to a short answer, just and conscious of time. But one of our attendees asked, what is a piece of advice you wish you had prior to applying to POCUS Fellowship? So why don't we start with D, and then we'll work our way around.
Oh man, this one's easy. Attend SCUF. I actually didn't know about SCUF until like after my fellowship, which is a different story. But yeah, come to SCUF.
I had never been to SCUF until prior to this year, and it's literally focused on resources for fellows and for fellowship directors. So if you have an interest in building a program, it's a great place to collaborate, and is a great resource for fellows. So it is a really cool society with an annual meeting. Plug, it is in October in St. Louis. So even if you're considering, feel free to attend and get an idea and start meeting some of the people in the field. Justin, how about you? A tip you wish you had?
I don't have a phenomenal answer, so in the interest of time, you can skip over me.
Okay. Laurel?
Actually, when I was reviewing the slides for this, I think actually asking about how many shifts you have that are like with somebody is something to ask about. I accidentally ended up in a program where I have a ton of time with people and it's amazing. And I had no clue that that was something I needed. So that's always good to ask about.
That's a great tip. Sometimes when you're doing scan shifts in the emergency department, they're on shift. And so it can be difficult to get a lot of, proctored teaching time. So that's a great point. David?
I'd say there were multiple fellows in my program, and I really enjoyed that. I know not all programs have multiple fellows, but I think if there's more than one of you, it really helps give you a better experience.
Cool. Nicole?
I would say always be motivated, ask questions, and never say no, even if you're super busy. Just keep working.
That's a family
Natalie?
medicine answer. I love it.
I was about to try and advocate for some life balance, but I think that is always good advice. Natalie, I'll tag you next.
I would say be very intentional when you're applying to fellowship, because when I was applying, I realized like every single fellowship was really amazing and everyone was willing to have a family medicine applicant, even when they hadn't advertised that they had a family medicine position open. So if you come with the intention of what you want and what you want to get out of it and really go, like every single question you had during the slides were all really, really important questions, because then when you go into the interviews, you really, really like everyone's amazing. So it's like if it's going to be like a personality compatibility thing, it's going to be really hard to filter out that as a factor. So just really, really keying down what you want, and that's when the mentors at SCUF are very helpful in finding those nuances that you need.
Raymond, you're at the end of your application process and about to start fellowship, but what's something you wished you knew beforehand?
So the programs that were described earlier on the SCUF website are programs that have figured out funding, but there are programs that are not on that list that will consider family medicine applicants. I did interview at least one program that is not on the list. So if you are if geography is your most important thing, then it's worth reaching out to EM only programs to see if they will consider you.
Yeah, I think that's a really important point, actually. What we're presenting right now is our active programs that have advertised that they're accepting family medicine and internal medicine. But sometimes you just need someone to be that spark that initiates the opportunity for yourself and for additional people. So it doesn't hurt to reach out and kind of advocate for yourself. And you might be able to be the first fellow at a program. And obviously, with each year, more and more programs are getting added. So as we move forward, keeping up to date with the SCUF website or looking out at programs or institutions you're interested in. Kyle, is there something you wish you knew before the application process?
No, I agree with Justin. I agree with everything that everyone's already said.
Yeah. I think I would add, I did fellowship in 2020, and so like there was only a few programs in the country that were IM based, and I did a combined program. And depending on what your interests are, like if you're going to be practicing outpatient, for instance, in family medicine, you might want to be in a program where you have a mentor who's doing ultrasound in the outpatient setting. So you learn about how to navigate billing or even time to be able to perform ultrasound, because a clinic setting, you have 15 minutes for an appointment. So doing that in POCUS can be difficult. Or I know like David in his clinic, he's been able to do a POCUS block, so his morning session, he's able to scan for POCUS. So really having a mentor in your field in your specialty, who can help give you that guidance, I think is a unique add that not all of us are able to get because of the program you go to. But really thinking about what it is that you want to achieve with ultrasound and what your future career looks like and who might be the best mentor. If you're looking at setting guidelines, emergency medicine's been doing this a lot longer than anyone else, so being in a combined program might be helpful. If you're looking at personal practice or trying to expand within your specialty, then having a mentor who's done that. But I hope you can see from this panel how friendly and collaborative this environment is. And you can see that we have people from EM, IM, and FM here. And it's really a unique aspect when medicine has become so specialized that there's an area where you can still collaborate over something like ultrasound. So it's a really great place to be. And it's definitely at the beginning of the revolution within our specialties. So it's a cool thing to be a part of. With that being said, I know I'm conscious of the time. Does anyone have any closing remarks or tips or things that they'd like to mention that maybe we haven't covered?
Just wanted to thank both Nicole and Kyle for putting this together. It's super informative for myself, and thank you to all the panelists for taking your very precious time to do this webinar. Nicole, I feel ya. My 4-year-old escaped earlier. I had to shove him away. We all make it work.
Yes, thank you everyone for being a part of this and for the efforts before. I actually did want to give a shout out to some of the people who helped kind of collaborate and give the material that couldn't be present today. And with that, I just want to say thank you to some of our additional family medicine docs, Ryan Paulus, Pooja Dalal, and James Wilcox. And in emergency medicine, a shout out to Megan Leo, who's the current president of SCUF. Lindsay Taylor and Nova Panabianco, who are also part of our multidisciplinary committee at SCUF. And then in internal medicine, we have Tanping Wong, Gigi Liu, Irene Ma, Kevin Piro, Renee Drivsdale, and Keith Barron, all of whom help to kind of collaborate and make sure we're presenting all the information that's needed. So thank you everyone for your time. I hope this was helpful for those who attended and for all of our future applicants. So thank you everyone. Thank you, Kyle, for being co-host, and thank you to our IT department as well, Timothy and Maya, for helping us run this webinar.
And this is recorded, so will be posted on the website.
And lastly, I forgot to mention Natalie was kind enough to post some links, and so was Dee. Unfortunately, just with the settings, they weren't coming up for everyone, and so I reposted them, so they're under my name in case anyone wants to get those resources with ACP, STFM, Core Ultrasound, and SAEM. And lastly, I just wanted to say that if you have any additional questions or anything wasn't covered during this webinar, please feel free to send an email to info@eusfellowships.com. That is the email address for SCUF. So any questions you have generally about the application process, please feel free to send it there and you will get an answer. Otherwise, if you have any questions about specific programs, I'd recommend reaching out to their individual fellowship director. But thank you all for attending and for your time. Hope this was helpful, and hopefully we'll see you on the application circuit. Thanks, everyone.